All right, we will start. I've got an introduction so people can drop in while I'm doing my greetings. I'm Cheryl Noble, the Communications and Volunteer Coordinator for Partnership for Age-Friendly Communities. Thank you for joining us today at our Lunch and Learn presentation. I want to give a big thank you to our mission sponsors, UC Health and the Gallery at Fort Collins, who have made generous donations to keep our work going. PAFC is a nonprofit that addresses the needs of older adults, and we work in collaboration with community partners to find solutions that enhance the quality of life as we age in Larimer County. Our key areas of work are the culture of aging, housing, mobility, health and wellness, and healthy aging resources. We owe our successes to our many volunteers and are grateful for their generous time and commitment. Thank you. We are also grateful for today's speaker. Gil Atanasov is the owner and executive director of Senior Helpers of Fort Collins. Gil will be presenting on the hidden resources to help pay for home care. So there's going to be a lot of really valuable information, I'm sure. Gil is okay with you asking questions during the presentation, so go ahead and put your questions into the chat, and then we will get them answered. So thank you again for being here, and Gil, welcome. It's all yours.
All right, thank you. Can everyone hear me okay? All right, great. So we have looks like a fairly small group, which is great. We can ensure folks please ask questions along the way. It's a little bit more difficult, I realize, on a Zoom, but I think if you do the raise hand thing, or Cheryl will also monitor the chat. So please just fire in your questions. This is only as valuable as answering the questions that you have, right? So while there's a lot of prepared material, we can go through a lot of that quickly, and much more important for me would be able to answer most of your questions. So with that, maybe just by way of Cheryl largely already introduced it. So we provide highly skilled non-medical in-home care across northern Colorado. So primarily Larimer and Weld counties, as well as up into Cheyenne, Wyoming. And one of the key things that we're finding is, of course, affordability for home care is always a question and a challenge. And it turns out that there are a number of different ways to pay for this that many people aren't aware of. So our goal is to try to educate the general public, those that are in positions who are connected with others. So social workers, nurses, doctors, facilities, and so forth, so that their residents and patients and clients are aware of some of the services that are out there. So I'll jump in. Let me share my screen here. I'll jump in, but again, please do interrupt. I encourage you to interrupt and ask questions, which again I realize is not as easy on a Zoom call. All right. Can folks see my screen?
Looks good.
Good. All right. That's always a good first step to make sure people can see.
Yes.
So yeah, let me jump in. I'll probably go through a lot of this fairly quickly. I think we have an hour. More valuable for me are trying to answer your specific questions, but we'll still keep going through as we can. So just a little bit more detail about what we do. If those of you that are familiar with home care, I realize this might be repeat, but in case you're not, it's, our goal is to help folks age in place, mostly older adults, wherever you call home. So it can be your primary residence. You can be living in assisted living or even a memory care unit, and we can still come in and help wherever you're calling home. And the things that we can do is we can assist with the personal care around activities of daily living. So that can be things like bathing and showering, dressing and grooming, assistance with eating, assistance with toileting, assistance with transfers, even if it's just simply trying to get from, the bedroom to the living room, that's a key component. And then we can also do other things such as companionship, meal preparation, assist with groceries, laundry, medication reminders, and those types of things. So yeah, I mean, I already kind of talked about what the goal of talking this today. So bear with me. I'm going to flip through the slides fairly quickly. But again, please ask any questions along the way, or if you need me to back up or slow down or review something that caught your eye, please just virtually raise your hand or put it in the chat. I think it's no secret. This organization is a wonderful one, and some of this information may have even come from there. We're living longer, right? I mean, when you think about when the Social Security Act it was put in place and Medicare, the target was 65 years old, and at that time, 2% of the U.S. population was aged 65 or older. Fast forward to 2025, and now 2% of our population, to get to 2%, you'd have to be 85 or older. So obviously, very different and changing dynamics, which is all in general a good thing. But and it's just as we age, who doesn't need or even want an extra pair of hands at times to assist? So, and the reality is that 70% of us will need some assistance at some point in time. And we get it. There's a lot of barriers to this. Maybe some of you are in this same boat. Maybe it's your parents or grandparents that are in this boat. A lot of us feel like maybe we don't need it for a variety of reasons. Hey, I already have some help. Well, your son or daughter is potentially in that sandwich generation, right? Where they're also still working, probably full time. They may still have young children at home they're responsible for. I know I'm in that boat personally. I still have a kid in high school and aging parents. So we're kind of in that sandwich generation that while you may have sons and daughters, they have other responsibilities as well. This is a big one. I'm fine. And I get it, right? A lot of us don't want to admit or even have to rely on others, but I feel like a lot of us, you get to a certain point in life, you get to a certain age, who couldn't use the extra pair of hands, as I mentioned earlier. And quite frankly, I feel like, hey, you've earned it, right? So why not take advantage of it? And then the fear of change, we get it. Don't want to leave home, don't want to change the same routines we've had. So a lot of times home care can be that bridge before moving into an assisted living. And there's many folks that are able to age in place at home all the way through end of life. And then the main reason why I'm chatting with all of you today is how the heck do I even go about this process, especially if knowing that it can be expensive. The next point here. I do that a lot, by the way. I will talk about the thing that is on the next slide because I can't remember the exact order they're all in.
Mhm.
All right. So I mean, I already alluded to this, right? I mean, if your spouse or adult child is the primary caregiver, 3/4 of them are working, it can interfere with their job. They have to be able to take care of themselves, even if it is your spouse, if coffee with the guys in the morning, or, maybe getting your hair done once a week. We always say that you can't take care of others if you don't take care of yourself first. So, key message, don't ignore the signs. What the key thing I want to be able to take away or have you take away from this, and we can share this presentation out, is give us a call. A huge piece of what we do is consultative. So you might have a question. I don't expect anybody to memorize everything we're going through on this during this conversation. So just make sure you Google us or jot our phone number down and give us a call, and we'll try to walk through your individual situation. A big thing about the healthcare system, right, is it's still largely, even here in 2025, treating the fall or the accident or what has happened instead of trying to prevent it. Medicare and other insurance companies are happy to pay, $150 to $250,000 for a double hip replacement because of a fall, but aren't really set up well to prevent the fall and pay for home care a few $100 a month maybe to get the rugs out of the house in the first place and prevent the fall. But so unfortunately, that means that these emergency room visits are still on the rise. And obviously, as you get older, the visits increase, which shouldn't be surprising. And then once you do get home, we do a lot with being safe at home. Let's put some of those preventative pieces in place so that we can prevent kind of that repeat situation of the cycle of, ending back up in the hospital, rehab, home, and repeat. So just some ideas. I mean, again, a lot of us probably are healthy, but certainly could potentially need some help with just one or two things, as I alluded to earlier. It can be a companionship piece. A lot of folks, family, children, the children move away, or you've moved away, or whatever the case may be. It can simply be, loneliness and trying to help avoid some feeling of isolation. Just one quick touch point here. A key thing about senior helpers is we have a proprietary assessment tool called Life Profile, which is very data driven. Back in the day, it would be we'd come out, we'd have a conversation, and we think, oh, we think mom or dad might need a few hours a day or a few hours a week. Well, we have a very comprehensive program that goes through different areas, including safety risks, so needing DME, durable medical equipment as an example, and some other things besides just home care that can really improve the safety in the home. If we see things like this, right, trying to get into the basement or the, storage area, that obviously poses a safety risk. Even just getting to the laundry room, I joked, I did this presentation for the senior advisory board in Fort Collins yesterday, and I joked that this could very well have been our laundry room and storage room, a picture from there. So, and then just even trying to find, can you find the pillbox in these pictures? I'm guessing the answer is no. Can you find the mortgage statement or the electricity bill that's due at the end of the month in this picture? A little bit of a challenge. And then, the key thing with this is it is an ongoing process. So we'll come in and do an initial assessment and give kind of a scorecard of what's going on. And what's nice is we can, again, through data, prove if we come back 3 to 6 months later and do a reassessment using Life Profile, we can show that we've, very much lowered that risk. Any questions about any of this at this point? I'll give it a few extra seconds because it's a little harder to ask the question on the Zoom, I totally get. All right, I'll just keep going. So, and of course, there are options. But I think in talking with this group, what I know about the Northern Colorado community, nobody wants to go into a nursing home. People want to stay in their own homes and stay as independent as possible. And that is really the place where we can truly assist. And then the other big piece of it is cost, right? You can see the numbers here from a couple of years ago, what it costs for home care. You can see that if you get down into the assisted living, I mean, I think that number is actually very low. If you thought about if I updated this for Colorado, which I didn't, I think that number is going to be closer to $8,000 in 2025. And then you can see those numbers are only going to increase over the next 10 years. So affordability is another key component. Oh, good. Chris is on. I'm going to make her do all the talking now. Oh, just teasing. Um, all right, we'll just keep going. And we completely understand. How will I pay for the care? Private pay is still the number one way. Most people are doing this, but we get it. It is becoming more and more expensive, and there's a lot of things out there, competing for our dollars. So a huge goal of today, whether you use this or not, is just to provide some education that there are some other options. Um, for example, I will ask, and I know maybe not everybody's paying attention, but by show of hands or just shout, take yourself off mute for a second, shout it out. Anybody on this call that has a long-term care insurance policy? I'm just trying to give it a couple extra seconds for people to chime in and say yes or no.
I don't.
Okay. Wonder if you can do the poll thing. Well, I guess we won't get too fancy. Okay. All right. No worries. We'll breeze through that. How about any veterans on the call or a spouse of a veteran? I'm guessing. I think I see Trish. I think I see your head nodding there. All right. Anybody else? Well, my guess is there's probably a couple. And then of course, all of us are, once we reach age 65, are eligible for Medicare, excuse me. And then many of us also likely have Medicare Advantage plans that supplement what we're doing with Medicare. So we'll just briefly touch on a handful of these topics, just so you can get a sense that there are other options out there. And again, as I said, give us a call, send us a message, let us know, and we can talk one-on-one about how we can help you or a loved one.
Gil, I do have a question with regards to
Yeah.
long-term care. You're probably going to touch on it as you go through each of the options, but that has always been a little bit confusing for me. And I think I heard that at some point you become not eligible to to sign up for long-term care. With regards to the older you get, you're not eligible to get it. So am I off on that or
Yeah,
misunderstanding?
I think that's a fair question. If you currently do not have a long-term care insurance policy, just like life insurance and many other things, the older you get, the more it's not that you can't necessarily, it's not that you couldn't get it, but it just becomes that much more expensive, right? So let's pick on, just term life insurance. To get $1 million policy when you're 25 is pennies on the dollar per year. And then by the time you get age 55, if you want that same $1 million policy, it's going to cost you, probably thousands of dollars a year just because you're obviously closer in age. And, there's health factors and so forth. So long-term care insurance would work similarly, that as you get older, it's going to just be more expensive to insure you because the likelihood of needing it at 25 is, much different than it is at 55.
Hmm. Okay.
So one of the biggest misnomers or things that aren't accurate out there is that in order to qualify for your life-term care insurance policy, you have had to have moved into an assisted living or nursing home, and that is absolutely not true. Well, I will say that with a caveat that every single policy is unique and different. I mean, I've been at this for 10 years now and haven't seen two policies that look alike. Um, but one of the key things is, when can you make a claim? Typically, once you need help with two or more activities of daily living. So again, those are kind of showering, bathing, dressing and grooming, eating assistance, transfer assistant, toilet assistance, or a dementia diagnosis are usually the triggers for when a claim can be filed with your long-term care. And it can absolutely be when you're still at home. Um, and it's assist with. I'll use the a shower as an example. It may just simply be that our caregiver is standing by, making sure you're safe or you don't need anything. They might just be right outside within earshot of the bathroom. It could be as simply as handing you the towel when you're done because the rack might be behind you or something. And that qualifies as assistance. So one of the biggest, let's see if it's in here. Yeah, this is just talking about that they're highly variable. The thing I want to highlight here is the elimination period in any of these policies, which is basically like the deductible of a policy. Most of the ones I've seen have a 90-day elimination period, which means that the benefits don't kick in and you have to pay out of pocket for that first 90 days. And if you recall from the slide I showed about how much assisted living is costing, especially in Colorado, or if you were to wait until you moved into assisted living, that would mean you'd have to pay $10,000 a month for 3 months or $30,000 before any of the benefits of the policy would kick in. However, if you make the claim and get it determined that you're eligible while you're still living at home, many times just 1 hour of service with us or any home care company will equate to 7 calendar days of service. So imagine only having us in there for 1 hour a week for 12 or 13 weeks at a few $100 maybe for each of those shifts, or not even $100 a shift. That's $1,300 to get through that elimination period versus $30,000 waiting until you're sitting in assisted living. Does that make sense? Any questions
There's
or
a question
thoughts
in the
on that?
chat box. A
What
question in
was
the
that?
box. The people get denied long-term care plans due to pre-existing conditions similar to health insurance.
If the policy, I mean, they should not, that should not be the case. Again, every policy is different. So unfortunately, I got to say, it depends on the policy. But in general, no. I mean, again, if you wrote the policy when you were 40 and you were healthy and it's been funded and you've been making your monthly payments, heaven forbid, if you get a cancer diagnosis or a Parkinson's diagnosis, and now you need assistance with those activities of daily living as a result, it should not be denied in general. But yeah, that's a good question. It's not like, other forms of insurance. I guess technically you would have to go through with your financial planner or the folks that's writing the policy what your, conditions are at the time. And I'm sure there is a health related component at the time the policy is written, similar to like health insurance. Did I make it confusing, Cheryl?
So it's possible, my understanding, there does seem to be some underwriting involved with it.
There
And
is. Yeah.
and it could be circumstantial with regards to when the policy is being taken out and timing, and that there are some health related questions. So, but in general, it shouldn't be denied, even though it's going to be goes through an underwriter and there's going to be health questions.
Right. Yep. Yep. I think that's exactly right. And I think just to kind of recap, I think we went over this before. If you need assistance with at least a couple of those ADLs, and then if there's a dementia diagnosis, that is typically a trigger to become eligible as well. A lot of times too, folks will be concerned, are they going to run out of money if they started at home and by the time they perhaps may need to move on to assisted living. But the reality is, as you can see here, a person, 70% of people don't ever get the full value out of their long-term care policy. And even half of the folks never use it at all, as you can see in that first bullet there. and again, you might just need a little bit of assistance with a couple of ADLs and you would qualify typically.
And
Again, if there's more questions on this, please don't hesitate to reach out. A key thing here I want to highlight is that, we've actually gone through, half dozen of our staff have gone through and have become long-term care claims professional certified in this. So we went through a day-long training. I got a 200-page booklet. Got to pass a test and everything. So we're not just kind of shooting from the hip. We genuinely do know what we're talking about in this space, which can be very confusing.
and then one last question, I hope from me on this. Is there a cap then with regards to what they'll pay out? I mean, or is it as long as you need it?
Well, that is what would be in the declaration pages of every policy. So oftentimes there will be a daily maximum benefit or a weekly or a monthly, and then there is typically a lifetime maximum benefit as well. And it could be as little as $50,000. It could be as much as over $1 million, depending upon when you started the policy, what you signed up for. But again, if I were to go back a slide, actually went the wrong way. The reality is most people don't run out before they pass away, actually. Did that answer the question? I just want to make sure.
Yes.
Okay.
Thank
So,
you.
but that's the thing is, that's the whole point is, kind of from a consultative point of view, give us a call. Every single policy is different. There are many, spent hours on the phone with long-term care insurance companies with the clients to navigate through and really understand how that particular policy works. For example, I was just working with a person in Cheyenne a couple of weeks ago, and it turns out he paid extra along the way, so he did not have an elimination period. I had never seen that before, and that is super rare. But his benefits were going to kick in day one, and not have to wait the 90 days. That's pretty typical. And I think, Kat, hopefully I see your chat question now. I think Cheryl asked it on your behalf earlier, so I think I did answer the pre-existing condition piece. But they should not be able to deny it with a pre-existing condition. I mean, because it would have never gotten written in the first place. The denial of getting coverage could happen because of a pre-existing condition, but if you have long-term care coverage, they should not be able to deny it if you've been paying in on the policy and have been current on it.
I guess my question was more related to Cheryl's example of if you wait too long to take long-term care on, like to find and pay for a policy, if you have too much going on, you might be denied a plan.
I think that's fair. Yeah, I think that's fair. I mean, yeah, you're going to have an underwriter that's going to, look at all those risk factors and some type of a actuarian that, plugs all your data into a chart and decides if you're insurable or not, and if so, how much should it cost? Unfortunately, but yeah, it's a good point. All right. Anything else on long-term care insurance? All right. Let's talk a little bit about the VA. I know I at least saw one head nod about having being, I think, either a veteran or a spouse of a veteran. Perhaps there's a couple others as well. Whoops. I guess that's okay. I was just trying to scroll through real quick just to make sure I didn't see somebody's hand up or the chat. So there are a couple of different programs. This first one on this page is the Community Care Network Homemaker Home Health Aid. What is shocking, quite frankly, to me is that almost no one we talk to are aware of this benefit. In fact, last month or a couple months ago, I was at the Loveland Clinic the VA Loveland Clinic, chatting with a bunch of folks, and the patient advocates, the volunteers, and even other employees of the VA were not aware of that program. And there are some criteria around it being service connected and being disabled at a certain percentage. But just like a doctor can order DME equipment and prescriptions, they can order a prescription for home care, and it's often anywhere from 6 to 26 hours a week that is fully covered by the VA. So it's one of the key questions we ask anybody that we go into their homes, because again, if the VA can cover a portion, even just a portion of the cost, that of course is a huge benefit for our clients and patients, right? Just to not have to pay for everything out of pocket. And then there is another program, which is the pension portion of the aid and attendance program. That's typically the one that is for surviving spouses, if they're eligible. And they've had to have been, there's some criteria you had to have been in during wartime and so forth. I can talk a little bit more about it. Just, you can see that, across Colorado and Wyoming, you can see that veterans do make up a huge percentage of our population here. Just trying to see. So you can see that last bullet point. There's over 100,000 folks across northern Colorado and Wyoming, or I should say Colorado and Wyoming, that are eligible, many who are not even aware. Most, I would say 95% are not aware, based on the conversations we've had with families and staff over the last several years. So just a little bit more detail. There's the Homemaker Home Health Aid and the respite that can literally be ordered by your VA primary care physician. And even if you don't go to the VA for services currently, you can get enrolled to see a primary care doctor through the VA and talk about the potential for some of these services and benefits. Here's some information about how to contact the VA, but again, the key message, key takeaway, contact us and we'll help you navigate through the system. The aid and attendance does have a income component to it. If you try to go through and qualify for this through the VA directly, it will take you months, if not over a year. We have partnered with a third-party company that gets the basic information, goes back to the VA on your behalf, or your husband's behalf if you're a surviving spouse, husband or wife, and we can typically get an answer back in weeks. There was another example where I was talking to someone about this, and it took her 13 months to get an answer from the VA directly, and the answer was no, you're not eligible, which was terrible. And I think her husband had actually passed away in the meantime. Whereas at least, we could have at least gotten her that answer much sooner. And then just a little bit more detail on eligibility for aid and attendance. Again, when in doubt, just give us a call. We're happy to help navigate each individual situation. We actually have a nurse on staff that does all of our assessments and supervisory visits and reassessments for the VA, almost fully dedicated to that. And then another person who is our VA liaison, and she's the one that works, basically has a direct line into the VA to ask questions and go to bat for folks on their behalf. So pretty unique in that way, that I don't think many organizations, have a dedicated team for our veterans. All right. Any questions on anything we've covered so far? Because we're only going to move quicker as we get down into this next topic. All right. I don't see anybody in the chat. Cheryl, you see anybody with their hand up on the...
Yeah, keep it going.
All right, we'll keep going. So Medicare, unfortunately, currently Medicare currently does not directly pay for home care services. we'll talk about Medicare Advantage in a moment, but Medicare in and of itself, the government program does not. The good news, though, is that just over a year ago, they rolled out this GUIDE model. And I'm sure GUIDE stands for something. I don't have it memorized or know what it stands for. But what is required there is that if you have a medium to severe dementia diagnosis, you can qualify for GUIDE. And it provides 9 different components, one of which is home care, and that's where we can come in. It's not a ton of money or a ton of hours. It equates to about 75 hours a year, which is not a lot, but it's a starting point. And the health services that other companies provide around this are pretty comprehensive. So it's not just about the home care component. So it's pretty new in its, this is only year 2 of it. The good news is that I actually have to update these slides. I probably should have before today. Senior Helpers is part of a national organization, so we're all locally owned and operated. I, live in Fort Collins, work in Fort Collins, kids go to school in Fort Collins. But we are part of a national organization, and at the national level, they've partnered with this company called Synapticure. Similar concept as I was talking about with aid and attendance. Instead of things taking, months, they can help navigate through the requirements for the GUIDE program. The hot off the presses news, though, just as of Monday, is we are actually partnered with a company local to Colorado. They're called the name of their company is Always Home Care, and they are approved by the CMS to run the GUIDE program. And then when it comes to the caregiving respite home care component, we have an agreement with them to be able to provide that. So that's great news because it's going to be local. They're going to know the market better. And then the speed in which to get answers and most importantly, start getting services is going to be that much faster. The interesting thing about this program, though, is there are also things that disqualify you and would immediately disqualify you. So if you have Medicare Advantage, you cannot participate in GUIDE. If you, over time, go on to hospice, it also ends your ability to be part of the GUIDE program. And there's a few other restrictions and requirements too. But again, if you or a loved one or someone has that dementia diagnosis formally from a doctor and have straight Medicare, we'd be happy to try to help navigate that for you. More detail than we want to go in here. Lots of words on this slide, so I'm going to flip through here. I think the key is that there are actually 9 points to all of this, as you can see. You've got the assessment, the care plan. There's a medication management component, and you can see that there's ongoing monitoring and support, and the respite is just one that we provide with the in-home care is just one component of it. All right, any questions on that? Okay. Spend a couple minutes on
Sorry.
Medicare Advantage. Oh, yeah, please go.
Sorry, Gil, I do have
Yeah.
a question.
Yeah.
I work for Lamar County's Office on Aging in the Family Caregiver Program. So I'm super curious about GUIDE. I've heard about it a little bit here and there. So from what I'm understanding, if I have a caregiver taking care of somebody who qualifies for GUIDE, are you saying that they could access those 72 hours a year from Senior Helpers?
Yeah, they should be. So they would first go to there's only 2 providers in all of Colorado that are qualified through the CMS, and
Okay.
it's Always Home Care and Bloom Healthcare. So what we would do is most likely connect them, and then Bloom is a closed system, not a negative. We love the folks at Bloom, but theirs is a pretty closed system in terms of you have to be a Bloom client in order to get any of the services
Okay.
we're talking about. But then Always Home Care, they're open, right? So they're taking new folks, and you don't have to be part of the Blue model. So that is where I would not most likely, I
Yeah.
would definitely have you start there and can
Okay.
connect you with their program person to get that ball rolling.
Okay. So would somebody then, a client, like reach out to the Always Home Care first, or do they reach out to somebody at Guide first?
Nope, you would reach out to them first because if you reach out to Guide, I can't, which is Medicare. My guess is you know it'll be crickets, right? Or at
Okay.
least weeks of silence before you hear anything. So yeah, I would recommend. Yeah, so if you want to, shoot me a note offline or whatever, or give me a call, I can get you connected over with them. Because again, the whole thing about this presentation is education, whether you use us or not.
Yeah. Okay. Thank you. Do you know where Always Home Care is located? I don't know if I've heard
Um,
about that one yet.
yeah, I think they cover all of Colorado. I have a feeling they're
Okay.
based in Denver, but they're also locally owned and operated, and they have
Yeah.
folks that cover Northern Colorado. I've talked with the owner and their program manager, handful of times. So I'm not
Okay.
100% sure where they're located, but they're local.
Okay. I'll look them up. Thank
Okay.
you.
Yeah, or just shoot me a message too. My email address, by the way, and I guess I should have included it somewhere here. Maybe I'll stick it in the chat. It's just gil@seniorhelpers.com. And I'm sticking it in the chat right now. So yeah, feel free to shoot me a note and I'll get you connected with the right folks.
Okay. Thanks, Gil.
You bet.
Are they called Always Best Care Senior?
Yeah, I might have said always home care. You know what? Let me
Yeah,
let me since it's come up a couple times, give me a second. I'm
tried
gonna
to Google it and it came up Always Best
Yeah,
Care.
I think it is always best care. I said always home care because there's a couple of companies and they're all, they sound similar, but that does sound right. I'm gonna look on my phone. Just bear with me one second, and then that way we can triple confirm and make sure we're talking. I'm saying the right thing. Like I said, the agreement just was signed on Monday, so this is all hot off the press kinds of stuff. Let's see. Lisa Sharp is the person who's the program manager for them. And well, you know what? It's always supportive care. Let me put that in the chat too. Yeah, I thought it wasn't. Okay, so uh
It's confusing. There's a few with the names very similar. There's
yep,
all
yep. So it's
like
all and it's a little bit confusing because it's ALL, new word, ways supportive
right.
care.
I thought it was always like constantly.
Yep, yep, and it's not. Yep, yep. That would be too easy.
Thanks
Right.
for clarifying that
And then
because
Lisa Sharp, she is the program manager. Yeah, I'm glad you asked. I'm glad we're taking the minute because that's the point is don't, what no good if I give you bad info. All right. I am gonna just talk about Medicare Advantage. I'm assuming there's some folks on the phone or that have these plans or others, or know of others. Someone might have been raising their hand. Might. Um, so Medicare Advantage plans, right? The Part C, that is actually provided by your more traditional healthcare systems, right? Like United Healthcare, Banner, Kaiser, Humana is a big one. And it is through that there may be a home care component to be able to provide help at home. Um, Similarly, it can be difficult to try to navigate. There's very few companies that are contracted directly with Humana, for example. But again, we are partnered with a company called Helper Bees that's kind of an aggregator that has all these relationships so that we can provide the care directly to you, but then through them from kind of a paperwork and billing perspective. So I know I talked a lot about partnerships. Rest assured, we are the ones providing the care. It's just the administrative paperwork, red tape, billing kinds of stuff that we partner with these other companies, which just makes it a little bit easier than trying. Otherwise, you'd have to go out and get a contract with United Healthcare, Humana, Kaiser, all directly, right? Where this company is a little bit of an aggregator of that. So, again, the key message around Medicare Advantage is, if it's something you're interested in and want to look into to see if you qualify, let us know. We'll do some consultation. We'll talk with Helper Bees and see what we need to do to get the ball rolling. And we don't like to take no for an answer. For example, again, we did this presentation and someone has United Healthcare and Helper Bees came back and said, no, they're not part of the system, at least not in Colorado. And, so then we're, working with the Helper Bees corporate office and local office in Colorado to make sure that they get United Healthcare as included in the system. So that's the kind of stuff that we believe is valuable and important. So yeah, just contact us and we'll go to bat for you. Lots of detail around Medicare Advantage. I don't want to go through a lot of it. Again, there's a lot of information that we can make these slides available if they're not already. Point here is the good news is while it's been much, much slower than I would have anticipated or expected, and COVID certainly slowed it down a little bit, the numbers are increasing about the number of Medicare Advantage plans, including in-home care. And hopefully, I would have expected that number to be like 10x by now. You can see it's not, but hopefully that number continues to go up and to the right on this chart. All right, any questions on Medicare Advantage or anything we've talked about thus far? Okay.
And we assume then that if you're not on Advantage, but you have a traditional supplemental plan, that the supplemental plan does not cover any home care. It's only an option, might be an option with Advantage, like the Plan Gs.
Yep, unfortunately, that is true. Other than that guide program with the dementia diagnosis I was talking about. Yep.
I don't like that answer.
I know. Well, it goes back to what I said before, and I could preach on this or get on the soapbox, which I won't. But, our system, I think it's fair to say, it's not opinion, that is largely designed on treating things that happen, not preventing bad things from happening. I mean, there's a few out there. You got, mammographies and colonoscopies and so forth at certain ages, but those kind of preventative screenings even are far and few between. So yeah, that's my example of Medicare is happy to pay 300 grand for a double hip replacement, but not 300 bucks a month to prevent the fall in the first place with a little assistance at home.
Right.
All right. I have a few slides in here and I'll just talk about it and not go through any detail. Leveraging your home, if you're still living at home, is another way. There's reverse mortgages. You could tap into the equity. Lots of people are, everyone's heard the term, what is it? House rich, house rich, cash poor or whatever, right? I think that's a saying. But if you've been paying your mortgage for the last, 28 years and almost have it paid off, given the increase in value of homes, a home equity line of credit could be a real option to help cover costs. Reverse mortgages, there's lots of experts out there that do a lot. There's, that when there's a little caution, right? Because someone, even after you pass as the person who's getting the care or doing the reverse mortgage, someone is still on the hook to pay the bank back, which would then be your heirs or your kids, grandkids. So just a word of caution, I guess, around the reverse mortgage. But it's interesting, maybe the one thing I will say here is if you're still living in your home, lived there for a long time, you've been paying down that mortgage, the amount of equity, it is worth going to get the reappraisal, the new appraisal to see what, and not just take what, the Larimer County tax guide says or whatever. We just did that for a home and we've only had it for 4 years. And the value that they were willing to provide based on the, generic data they had was small. And then I said, okay, yeah, let's do an appraisal and see what that number is to get it more in line. And that number was much, was more than double actually what was available in the line of credit by taking that extra step to get the appraisal. We all know that, yeah, the prices are kind of out of whack. So if you can get a line of credit for a decent amount, it can certainly be helpful. And again, I'm not going to go into this detail. There's a lot of experts. We'll make the slides available. Happy to answer any offline questions. So yeah, I mean, the thing is there's lots of options out there. Does take some homework, does take some expertise, and I know I'm a little bit biased, but I do feel like our team has a lot of that expertise and can help navigate each individual situation to see where we can do some things and make sure you get everything that you deserve and you've earned over your lifetime so that it's not always just out of pocket. Just a quick screenshot of most of the team. Any other questions? I know we got a couple minutes left. I appreciate all the questions and attention thus far, but anything else anyone has? Questions, comments, concerns?
Will you be sending out a link to the recording? I tuned in late.
Yes, Keith, the presentation is being recorded, so we'll send it out through our newsletter, or I'll put my email address in the chat so you can send me an email. I can send you that link to the recording.
Thanks a lot.
Yeah, and Cheryl, anything you send out, feel free to throw that phone number and my email address that I put in the chat out there.
Okay.
All right. Whoop. Didn't mean to do that. Thank you. Perfect. Thanks. All right. Anybody have anything else? Otherwise, that's all I got for you. 5 minutes early. That's got to be a good thing, right?
Nice job.
All right. Well, thank you so much to Cheryl and the team for allowing me to do this.
Thank you.
Thank you.
Thanks.
Yep. Thanks a lot.
Thanks for joining, everyone. Take care.
All right. Take care.
Thank you.
Bye-bye.
Bye-bye.